Okay, we've broken the 50 mark, which I think is maybe a good indication that we can start. And if anyone is running a bit late, they can always join us afterwards. So I think it's time we begin. So hello, everyone, from wherever you are joining us today. My name is Daniel Nadal. I work in the Government Affairs and Policy team at Johnson & Johnson, but I am speaking today on a personal capacity, not in their name. And I will be a moderator for this webinar, which is co-organized by HYPER and the Governing Health Futures 2030, which is going to be all about digital health solutions and how they can advance diversity, equity, and inclusion. So maybe first of all, a bit of context and background into the organizations that have brought us all together today. So firstly, HYPER, of which I'm a proud member, is an IFPMA initiative that is dedicated to connecting and empowering young professionals that are working in the health and the pharmaceutical industry. And it does so by organizing webinars such as this one, but also Q&A sessions with experts, also inviting young professionals to write white papers on topics they are passionate about. And really the gist is to offer learning experiences on global health issues and also opportunities to develop young people for the leaders of tomorrow. So we work on a lot of topics, and we've worked on a lot of topics in the past, such as sustainability, diversity and inclusion, and of course, digital health, on which we published a white paper a few months back, and which is kind of the driving force behind today's webinar. And then on the other hand, we have the Lancet and the Financial Times Commission on Governing Health Futures 2030, Growing Up in a Digital World, which was established in 2019 to explore how our health and our well-being are impacted by the digital transformation of society, which we hear so much about. And after 2 years of independent research back in October 2021, I believe, they published a report proposing a new vision for the governance of digital. So moving away from what you might have heard, these models of commercialization and data extraction towards something that's more geared towards public purpose and data solidarity and universal health coverage. So really 2 very fitting organizations to co-organize today's webinar, which, as you know from the event description, is all about how digital technologies, which are changing the ways in which health and care are being accessed and are being provided, how these technologies can also bring diversity, equity, and inclusion into healthcare. And all of this will be told today with the perspective of the youth front and center. We will be showcasing some digital innovations that are already embedding diversity, equity, and inclusion principles into their design. Also some best practices to adopt these from all over the world. And we have a very geographically dispersed panel, so this part promises to be particularly interesting. And also ultimately how these digital health tools can help move the needle on health equity to really improve the lives of people. Then in terms of structure, we will start with a keynote to set the scene on the promise of digital healthcare and equity. We'll then have a panel with a broad range of representatives, and then we will have a Q&A portion, so all of you can ask your burning questions. But first, we have a Mentimeter poll, and we're actually going to be using this throughout today's event, so this is a bit of a warm-up. And you can access it, the instructions are on the screen, but it's very straightforward. Hopefully you've all used this in some capacity, or at least a software like this, so you'll be familiar, but you can either access it by scanning the QR code with your phone. You can also put the menti.com on your browser and add the code that you are seeing. And I think the link might also be shared in the chat. So hopefully it's quite straightforward. And I'll give everyone a couple of seconds to do so. I see some thumbs up, that's great. Amazing, and I should say we will be using this throughout today's session. So after we're done with this first batch of questions, don't throw it away, don't close the window, because we will be referring back to it. Maybe I'll wait until we have 20. Oh, perfect. So we're going to start with a very simple, straightforward question just to kind of break the ice and hear a bit of your perspective and see kind of how we should be phrasing this or framing today's debate. So it's a very straightforward question: is have you accessed, or would you be open to accessing digital health solutions? So very simple, yes or no, just to understand a bit what are the perspectives of the attendees, and then we can make sure that the panel is addressing either the concerns or the positive energy that we're receiving. And maybe just in case anyone is not familiar with digital health solutions, these can be things like telemedicine options, if those are available in your region, maybe an app that was recommended by your doctor. Maybe if you're very fancy, it's digital surgery, robotics, if you've had surgery. So anything that you can think in mind. And feel free to let us know in the chat, actually, if you have a particularly interesting example you would like to share, we would love to hear that. But I see, okay, I think the results are very clear. I wish there was more to say, but it's actually very straightforward. It's a yes. So it means we have a very digital forward panel, attendees today, or at least very open-minded to the use of digital health. So that's really positive. And actually, I think this is also great news because you will most definitely be enjoying our panel and our keynote speaker, who maybe I can, after these very clear results, maybe I can already start to introduce her. And hopefully she can join me on the screen as well. Perfect. Hi, Danielle. So our keynote speaker is Danielle Mullings. She is the Regional Youth Champion for Governing Health Futures 2030, and also the Impact and Partnerships Officer for Transform Health. She has been named a Young Expert in Tech for Health, selected as a University of West Indies Open Scholar, and is also serving on the UNICEF Jamaica Youth Council. Danielle is very passionate about technology, media, and communications, and very importantly also on the role of young people in advocacy. So I don't think we could ask for a better speaker for today's session. And I think with that, Danielle, I'll hand the floor over to you.
All right, thank you so much, Danielle. It's a pleasure to be here. I'm just gonna get my presentation up on screen really quickly. And to really start us off and start this conversation, I wanted to look at some of the barriers that we may have as we're trying to build this healthy, digitally connected future, right? And that being said, I'm going to start off with some of the key findings from the Lancet and Financial Times Commission on Governing Health Futures 2030. Right. And so the report was done back in 2019, as Daniel mentioned earlier in that introduction. And so here are some of the key findings from that report. Now, the first one is looking at digital divides, right? And how that is actually going to be affecting our health outcomes. And what we're seeing is that we're now having like digital determinants of healthcare. So that looks like, are persons connected to the internet? Do they have enough devices, etc.? And I'll get into that on the next slide. But other areas that are highlighted are power imbalances within digital health ecosystems, persistent gender and other societal inequalities, that are here in the real world, so to speak, that will also transfer into the digital world as we do that. Uncoordinated approaches to digital transformation that overlook young people's needs, are counter to health for all values, exacerbate health inequities, and fail to protect young people from digital harm. So these are some of the key findings coming out. Also, countries with the most youthful populations in the world are facing this double disadvantage of having weak health systems and low access to digital technologies, which can make that digital transformation a little bit more difficult in those settings. So that being said, I wanted to look at some of the areas here in the Caribbean that I've experienced through some of the work we've done. And these are some of the key requirements that I would say we need for a healthy digital ecosystem that is inclusive and really going to make an impact on the people that we want it to, right? And the first one is going to be access to hardware and devices. Now, it will be hard to implement any digital health solution if the target group, the target audience does not already have access to the requisite hardware and devices, right? And so there are a range of sub-factors that would affect that. For example, one conversation we're always having here in Jamaica is about like customs charges to import devices, for example, like to get a laptop or to get a new phone, etc. Those kind of barriers. And if there should be one that if we should have a reduced fee rather for persons who are bringing in devices for either work or education, etc. Digital infrastructure is also going to be very, very important. And that looks like, do we have the adequate wires running, for example, that will bring digital connectivity to our different households, especially those who are in more rural areas, right? Because right now our internet penetration rate is about like 55% or 57%. And some of our telecom providers are actually about to undertake a major project to actually bring increased connectivity to our, or more like socioeconomically disadvantaged households within Jamaica. And so, that would be exciting to see internet connection now reaching more people. And as a result, then we're able to use more digital means to positively impact them. We also have digital literacy being a huge key component of what's needed here. If we really want to include people and have our solutions, have our digital health solutions impact persons in the right way, then persons need to understand how to use devices, right? And that may sound quite simple, but I remember when COVID-19 just started, and I was working on basically the entire online education system, entire education system rather had to go online. And so I was helping with some, like tech support for one of the national responses, which was to have basically classes for students in high school and primary school online. And that experience showed me so much because one, I realized, some things that we may take for granted, like, all of us are here in Zoom right now. And, we knew how to log on to Zoom. We knew how to send a message in the chat if we have a question or raise our hand, etc. But those are things that a lot of people didn't know at the start. You also had other smaller details, like some households only had one email. Let's say maybe the parent or the father only had one email. And so, not everyone in the household was able to independently access information. And that may sound simplistic at first, but let's say you need an email to log on to a healthcare app. And it's going to have data that is a bit more private and confidential. So you don't want to have one shared email in the household, for example. So there are lots of different sub-factors that make up this idea of having a healthy and equitable digital ecosystem that is able to then respond to the needs of the population, especially within healthcare. The last area I'll add here is having culturally and regionally specific projects. And sometimes we may have organizations from the global north or so on coming and, let's say, imposing some solution, but it's not culturally and regionally specific. So it feels a little bit out of touch. And in that respect, I think it's important for persons from whichever target audience it may be. So if it's something that needs to be done in the Caribbean, then we need Caribbean voices to be a part of that solution. If it's in Africa, Africa needs to be a part of it. Canada, etc. The same thing can be extrapolated. So it's extremely important to ensure that the specific needs of the people are included, yes, and it is a response that's needed, yes, but also it's done in a way that the people can appreciate. So it has that cultural relevance. So I'm going to briefly just talk about two digital health solutions that we've had here. As I mentioned earlier, noting that we have this internet penetration rate here in Jamaica of around 55%, which may go up or down because I believe this figure is from 2 years ago. But that will then affect, the ability to access these devices. So UNICEF has a platform called U-Report. It's in a lot of countries all over the world. And this was actually quite instrumental in being able to provide a healthcare response in a different way. Now, typically what U-Report is it polls young people, right? So you'll ask questions like, what do you think about, let's say, national events going on? Or UNICEF may partner with specific organizations who may want to know more about, let's say, what young people in Jamaica think about the broadcasting commission or some of the activities being done there, or what skills do they want to prioritize to better move and transition into the job world, right? Now, it was interesting here because a few years ago, we had a dengue outbreak, and we were actually able to utilize the U-Report platform, which runs on like social media messaging platforms, by the way. So you can use it on WhatsApp, Instagram, Facebook, etc. But here we were in the midst of a dengue outbreak, and we were actually able to just quickly poll young people and identify what pieces of information do you think are missing? Like what do you not know about the dengue outbreak that could help you better respond that you don't know right now? And so one of the top responses that we got about, I think it was over like 2,000 responses within a couple hours, because there are over just under 14,000 young people signed up on New Report in Jamaica. So we're able to get the responses coming in, and the persons were saying, okay, we don't really know what the symptoms are. So we're not sure how to identify if they have dengue or someone around them has dengue. And that was very important information for us to get, because we're then able to, because this is in partnership with the Ministry of Health, we're then able to, one, send this feedback back to the Ministry of Health, who's then able to now implement that into their strategy and say, okay, here's what young people are saying is not reaching them. We need to change our marketing and communication strategy around symptoms to ensure that that's getting out to them, right? So that's one aspect. And two, they were also able to then give us that correct information that has been verified to say these are the symptoms, and we're able to then send that back out to young people via SMS or via WhatsApp, depending on which platform they're using. So that can show how digital health solutions can come in different formats. I know when we hear digital health solutions, the first thing we probably think about is telemedicine, or having wearables that would like track different things about you. But we can also have it in terms of it being an enabler of communication between both sides during an emergency. So it could be information flow just needs to happen in order to ensure that our people are informed and aware of what's happening. So I wanted to highlight that, that can be one way in which digital health solutions can go forward. So that example before is kind of looking at a response, right? So you're in an emergency situation and you need information to move between the Ministry of Health and the public at large, or specific groups of the public. Now we'd look at one that's more preventative in a sense, or I suppose mitigation, although it can be seen as a response as well as a mental health chat line. So one that's hitting some different areas in which digital health can kind of respond. So that being said, for the UNICEF mental health chat line, this was actually launched last year, and it had been a work in progress for many years. When I just started on the Youth Council, these are some of the ideas we had around it, and we did a workshop to develop it. So we had young people at the center of its development. And so it was finally launched last year, again in collaboration with the Ministry of Health. And essentially, young people across Jamaica can message in, again, using WhatsApp. They can message in 24/7 and actually talk to a trained counselor. And digital health solutions like these are important because it brings in these different stakeholders. It also is a collaboration with the University of the West Indies, Mona campus here in Jamaica. And so we actually have counselors. Well, some of them are like graduate students, or that they then they're then volunteers that volunteer to counsel via the mental health chat line. And then, if it's elevated, like let's say, the person is, suicidal or so on, or has more serious issues that need to be taken beyond that, day-to-day texting or counseling, then it's, elevated to the different arms of the Ministry of Health that they may have. So having that connection is also pretty important. But again, showing one way in which this has been able to help. Now, as I spoke earlier on, some of the requirements for this to function and for it to flourish, I mentioned that, digital literacy is going to be important, and infrastructure and devices. And within that respect, it was interesting that, when we're doing the U Report polls from before, and we'd be doing like activations, there are some young people who would say, maybe we don't have access to data, so data or internet connectivity to be able to send messages via WhatsApp. We don't have data, so we can't do that. It's inaccessible to us. And that being said, there's also an SMS version to this, so you can access some of these services from UNICEF via SMS as well in Jamaica, and that becomes very important because more people will have SMS as opposed to data. Of course, many people still do have data and internet connection, but it's trying to cater and ensure that it's diverse and equitable for all. Also, we had a major partnership with Flow, and Flow is like one of the telecommunications providers, and they were able to zero rate some of the text messages. And this again ties into all the areas that I mentioned on the second slide from the GH Futures report, where we're ensuring that the digital divide doesn't affect young people, and that young people are also involved in the planning and creation of these responses. And so these are two, great examples of, how this can work well when some of those findings of the GH Futures 2030 report are actually implemented. So overall, what we have happening is that the digital equity gap will inform our health gap and our education gap, especially as we move towards more digitalized futures. And so I found this diagram that I really, really like. I'm going to share with you. And I'm probably running out of time soon. But it basically looks at how digital literacy and access will affect these different areas of our lives. So it says the same things I mentioned earlier. We need skills and literacy, connectivity, devices, applications, training and tech support, which I can't underscore enough, is especially if you have people who are new to technology, that support and persons to guide you on this is how you do that. Here's a tutorial for how you access that, etc. Very, very important. And it affects these different areas of our lives, from the healthcare system. You see telehealth mentioned there, health apps, to community and the social context in terms of how do we engage and get news? How do you get the correct information as well, which we also saw coming out of COVID-19 with so much misinformation being spread? How do we get verifiable news, and how can some of our digital responses help us with that? Food, education, the neighbor and physical environment, digital literacy and access is going to affect all of these different areas. And so moving forward, I want to go back to the GH Futures report, and also just specifically looking at some of the recommendations for action moving forward. So the first one is to address the role of digital technologies as determinants of health. The second being build a governance architecture that fosters trust. 3, govern health data to increase its public value. And 4, invest in the enablers of digital transformations for public health. And as you read these, some of the points I've made earlier will come back and kind of jump out at you. From addressing the role of technologies as determinants of health, which is like the slide I just showed previously, showing just how it's interconnected and relating to all these different elements of our lives right now. And the enablers of digital transformations in point 4 will look like digital literacy, infrastructure, and that governance piece then becomes very, very important, because it has to be one that people trust. And in order for it to be something that people trust, it has to be very relevant to the region or the specific target audience. And it also has to be built with the people included, with their voices heard, because once it isn't done with their voices heard, there will be less trust and less relatability to this new innovation that's being added in. So that being said, it was a pleasure to give this keynote speech. It's been a pleasure speaking with all of you. And in the Q&A section, I'd love to interact further. Thank you.
Thank you, Danielle, for that energizing keynote, also emphasizing really the need to involve local voices to really understand their needs. And those 2 practical case studies where youth played a really critical role, I think were very, very interesting. And indeed, we will be able to delve a bit deeper during the panel and the Q&A session. I hope that's also inspired our audience, and they've been taking notes, because before we move on to the panel, we want to go very, very quickly. So we'll do a rapid fire round, actually. We want to go back to the Mentimeter poll to get your reactions and your thoughts and your ideas. So hopefully most of you have the Mentimeter still on hand. Otherwise, the instructions are the same as last time, but they're also on the screen. And I think we can head straight to the first question, because the instructions are still there. So it's very straightforward, and we've given you answers as well. So hopefully it's easy for everyone to answer. But the first question we want to ask is also based on what you've just heard from Danielle. Where do you see the most opportunities in digital health? for advancing diversity, equity, and inclusion. I saw some comments on the chat, which maybe are relevant as well, and they want to respond in the poll as well. But as you can see, we've put options that are sort of reduced costs, telemedicine, etc. I see those two are battling for the first position. We also have the option of representative data sets for AI tools, and also diversifying clinical trials. We also have an other function, so if anyone feels like they have additional ideas, please feel free to share those in the chat. We are keeping track of that as well. Okay, it's varying a lot. That's great. It seems like we have a very good debate going on. And it also kind of shows that they're all quite important in ways, maybe depending on where you come from, what you work on. Although reduced cost for both diagnosis and healthcare seems to be winning. I think that's an interesting result. Maybe for the sake of, oh, I see a comment, better access to healthcare. That's also an opportunity, indeed. Telemedicine as well, absolutely. Great, we can use that in the panel discussion. Maybe if we move on to the next question. So we just looked at the opportunities. Now we look at the other side of the coin, the challenges there. So do you have any concerns, or do you see any challenges when it comes to digital health? And Danielle also mentioned a couple in her keynote, but maybe you have additional ones. So again, we've proposed a few in the poll itself. So cybersecurity and privacy, literacy, infrastructure, ethics, and again, there's another function. So if you have any additional ideas, so I see the literacy comes up in the chat. Please feel free to share your thoughts. I see access and infrastructure is also coming up. I think Danielle also mentioned it, which makes sense. And again, we have quite a balanced set of responses, which I guess shows that it's a complicated problem, right? It's not just one solution, one problem. It's multifaceted. I think this is very interesting, and hopefully our speakers have also taken note, and they'll be able to refer back to this when they are giving their interventions during the panel. And if that's okay, actually, I think we can head to the panel, because our panelists have been very patient waiting on the sidelines. I think it's time we bring them to the light. So first of all, joining us from Jamaica, we have Danielle again. So she just gave a great keynote. We can hopefully start to unpack in more detail some of the concepts that she introduced. Then joining from Uganda, we have Nuriet Nambogo, who is the CEO of Mobicare, which is a mobile platform connecting patients and doctors, but she will tell us more about it. She is also the winner of the Africa Young Innovators from Health Award, which is a partnership between IFPMA and Speak Up Africa, focusing on supporting young voices of health entrepreneurs. And she is also the research and grants manager for the Consortium for Affordable and Medical Technologies at Mbarara University of Science and Technology, where she's also the program coordinator. Then joining us from Kenya, we have David Odhiambo, who is a regulatory affairs manager at Novartis in Kenya. And he's also a fellow HYPER member, so hi, David. He has a background as a pharmacist, but he's also previously worked at the Kenya Association of Pharmaceutical Industry and the Kenya Healthcare Federation. And he's also the co-founder of Right Culture Health and Social Innovation, and the curator of the African Pharmaceutical Network. And last but definitely not least, joining from the Philippines, we have Einstein Rojas. He is representing the Philippine Alliance of Patients Organization, which is an umbrella body serving as a network of patient groups that aim to empower Filipino patients. He is a part of the Global Advisory Committee on NNCD Alliance, based in Geneva, Switzerland. And he is also an innovation and venture architect and foresight consultant at embedding Group. And in terms of education, he has a Master's in Science, Masters of Science in Business and Innovation from the Asian Institute of Management and the Global Innovation Management Institute, which I know you will talk a bit about later. I think that's it. So great to see you all on the screen. Thank you for making the time. And let's just get right into it. So Nuriet, let me start with you, if that's okay. Really setting the scene with one of the digital health solutions that I know you've actually developed, which is called Mobicare, and which I briefly mentioned. Can you maybe tell us a bit about it? So quite briefly, and I should say, if we can, let's all keep interventions to 3 minutes if we can, just to make sure that everyone gets a good chance to share their experience. So Nuriet, can you tell us a bit about Mobicare, how you identified the need for this solution, and if you received any feedback from the users already?
Thank you so much, Daniel. Yes, Mobicare is a mobile-based application that helps to link patients to doctors for appointment scheduling. MobiCare started out of a personal experience, something that I experienced while I was pregnant, about 2 to 3 months pregnant. I developed a pregnancy-related complication that required me to be seen by a doctor. So I went to one of the health facilities where I used to do my checkups. And the physician, the doctor who saw me, recommended that I needed to be seen by a gynecologist. Unfortunately, that day, the gynecologist was off duty, and they had to call him on phone. He said he was not available, and then he referred me to another health facility. Unfortunately, when I got there, that gynecologist was also not on duty. He had just left actually. And so I had to get back to the my first doctor who recommended, the gynecologist who recommended that I could see him the next day. However, I had to be patient, but the pain was, I had some pain, but it was not a lot. So the next day, by the time he saw me, I was examined and did a scan, but they found I'd lost the pregnancy. I don't know at what point, but in my mind, I thought, how many people go through the same experience every day? People who are not of my class, people who are not, you need a pediatrician, you need any specialist. And in Africa, mostly, our specialists are few, and also they do work in different health facilities. So you find your services are needed in different health facilities. So the time when you need them, you cannot find them sometimes, or you cannot know where they are at the time that you need them. So I started thinking about how we can easily have access as patients to doctors and request them for appointment directly. That's the background of MobiCare. I put together a team. We started developing the first versions of MobiCare. And we piloted it. Of course, we used the design thinking approach to gather as much feedback as possible from doctors and end users like patients or caretakers. And then we had to pilot it. And right now it's deployed in some health districts, so it's in use. So most of our digital health solutions are based on challenges, of course. And all of them, any solution, any innovation should be challenge-based. So I put together a team, most importantly, as an innovator or as people who want to come up with health-related solutions. Even if you're a doctor, you need a multidisciplinary team. This team has been able to help me to move this innovation where it is, get some grants to help us, and also make sure that we stay focused. Myself, we run the Consortium for Affordable Medical Technology. It's, like Daniel said, it's an innovation hub at Mbara University of Science and Technology here in Uganda. So we do work with a number of innovators in health, people who have who would like to provide solutions in health, whether hardware or software applications. So we have developed an innovation ecosystem through which we take these innovators, and we have tested it. Of course, like myself, I did a certificate in master in design thinking from MIT, and the rest of a few of my other colleagues. But when it comes to digital health and all innovations, what I tell people is that concentrate on understanding the challenge first. If you don't define the challenge well, so you find you're developing a solution that cannot be scaled up or will not benefit the end user, because you sit back home, you sit in your office and think about this beautiful solution that you want to put up or to develop, because you have the skills, you have a competent team that will develop this application, but you have not thought about the person who is going to use it. With design thinking, you engage the end user as much as possible because you're not developing this solution for yourself. And also, as an innovator, you develop with a business mind because this solution has to be self-sustaining. If you don't have this business idea of how will this solution sustain itself after the grants, after all this support from organizations, how shall we ensure that without the grants, the solution will survive in the market? So that is something that I always tell people. Understand the problem first, get as much feedback as possible from the end users. Every stage of development, ensure that you engage, even if it's the first, before you start developing, go to them, talk to them, get to know more about theirs, because this is their pain point, and then understand how this solution will fit, or how the solution that you will develop, how it will be able to fit their settings and solve their problem. Once you have the first version of your prototype or your solution, please take it back to them and gather feedback, and you engage them, asking how it feels. If it's an application, ask them what they think about the different features that you will have input into your system. When we were developing MobiCare, we actually, the first version, we thought we had a very good solution. When we took it to the doctors and the patients, we were surprised how much information, how much feedback they gave us. Most of the things we had put in MobiCare did not make any sense to them. I remember some of them telling us how, you think for us we know everything about smartphones. We don't. We realize that people hold smartphones, but they actually do not know how to use these smartphones. They can only call, take calls, message, text, and go on WhatsApp. But if you develop something you thought that is as simple as people will use it and know how to use it, you're lying to yourself. So you need to engage them to understand whether what you're putting is what they need. So we had to go back to them. They gave us feedback. Of course, after that feedback, we came back to the lab and redesigned the specifications of how they thought MobiCare should look like. We input all the feedback and took to them. We tested, of course, in-house testing, and then we took to them with the features they had proposed. But of course, more improvement up to the extent of some doctors told us when we thought actually we had the final version of MobiCare. One doctor asked us, now, what if
Actually,
because
no,
it
yeah.
was
Is it okay? Just because I see you're really talking a lot about the doctors and their perspectives, and I know actually David has a lot of the experience working with healthcare professionals and with doctors themselves. So I wonder if just to keep the conversation going, maybe we can see his reaction to this point as well. I know, David, what is your experience, using applications like MobiCare or others that may be available in Kenya? Have you heard a lot of perspectives from the HCPs on their reaction on digital health solutions in general, and maybe some of the points that we saw in the poll resonate?
Thank you, Daniel, and thank you, Nuriat, for actually setting the stage for us and Daniel as well. So drawing on that, one key thing that I just want to mention first, I work with Novartis, but the comments and the sentiment that I'm sharing are personal views based on the work that I'm doing in the digital health space. So based on my experience actually in the Kenyan space and also in an African context, when you look at it from healthcare providers and practitioners, most of the doctors are pro digital technologies and digital solutions. And this actually had an upshot during the COVID-19 period, where we saw almost every other company was setting us and coming up with digital technologies. And when I look at the back end of it, most of them were either being driven by young medical doctors, young pharmacists, young nurses, offering consultancy services and even offering home-based care services. But the dynamic of that in terms of uptake from the healthcare providers, that's amazing. But the gap is one, for the most senior professionals, being most of them have not been as much conversant with the digital technologies, they're not embracing them as much. So that is one gap that we are noting in terms of the healthcare providers' perspective. But then the other gap that happens now in terms of adoption and utilization of digital technologies is about who are the people we are serving. As a doctor, for me to use a digital technology, it means there must be a patient who is interested in using this solution. So do we have the patients embracing this? Most of the young people would do it. And actually, I saw in some of the comments when Danielle was making her presentation, somebody was asking, how many patients share that information? As a pharmacist, and I can tell you for a fact, even when I was in the university, you'd find somebody in the village sending you a text message, and they are seeking guidance and counsel on a particular condition or a particular healthcare challenge they're dealing with. That is already in the digital health space. So the question is, how do we ensure that these are mainstream and captured as digital health solutions and ensure that we can move it forward? So I think that is the dimension. Healthcare providers, physicians, the senior are not adopting it. Majority are adopting it and embracing it. But the question is, how are we getting our patients into the dynamics? And that is something that I think we can tap into based on what Nuria has shared as well, because unless the general public are taking it up, they are not going to get value. And the only way to make them to utilize the digital technologies is by developing it from their perspective. I know my mom and dad are in the village. They don't know how to use most of the they have a smartphone, yes, both of them, but they use it for calls and messages. What if I got an app in that phone? Probably they'll even never know that that app existed for medical care. So we need to work on those solutions with them where they are so that they come on board, then the physicians and the healthcare providers can offer the solutions. Thank you.
Thank you, David, for really highlighting the importance of co-creation, I would say, and bringing people early into the conversation. You also mentioned patients, and I think that's a very good segue actually to bringing Einstein into the conversation, because as I introduced before, you are here partly as a representative of the Philippine Alliance of Patient Organizations. So I'd like to hear your thoughts. We've heard of the innovators, we've heard from the doctors or the healthcare professionals. Where is the patient perspective? What do they think in this debate, at least in the Philippines context?
Yeah, definitely. I love to talk more about the Philippines, but I like to react on the survey a while ago. I was triggered actually. I'm a very fan of the AI, artificial intelligence, and how you can interpolate data out of it. An insight out of it is if you focus on the data and use AI to analyze it and help you create an algorithm, you can actually address all these problems, including reduction of the cost, addressing telemedicine like to what we are experiencing in ChatGPT. So going back to the Philippine settings, we are definitely anchored in the World Health Organization 6 building blocks of health systems, where we mainly focus on its service delivery and information. So as patient leaders, we mainly focus on what we can do. I'm glad that David mentioned co-creation, because we in the Philippines, we recently launched a postgraduate certificate for patient leaders. Imagine patients who just went their sickness and was able to recover, now being trained, given a postgraduate certificate to work with the government, with the academies, and innovators like us, especially the business minded in the Philippines, where they co-create solutions to be implemented directly in the government. So going back to Nuria's points on design thinking, getting feedback, we create a whole system of it inside in an academic school room. So you get feedback from all the stakeholders, and creating those MVPs that will help patient empowerment.
It sounds like a really fascinating project, and really, again, bringing in academia as well. So really bringing all the perspectives together. It sounds really great. I'm glad you brought that up. I think maybe the one perspective that we are, just to really complete the table, is maybe the youth angle, other than obviously the panelists here. And I know, Danielle, so we heard a lot from you about projects that are really involving youth. And I think there's more of a personal question. I'm curious, what has been your experience working with governments and with international organizations as a youth representative, or working with youth? Have they always been very welcoming of your ideas? Did you have to fight to make the youth voice heard? I'd love to hear about your experience there.
Yeah, thank you. That's a great question there. So right now I work with the Transform Health Coalition, and I would have previously been on the youth arm. And what I like about Transform Health is that, equity and inclusion is a part of like all of our major indicators so that we know that one, the overall coalition is functioning well, but also we have these equity and inclusion indicators that address like, the number of partners in LMIC countries, but not only just them being present and being a partner, but also how they contribute to some of our key outputs, such as our printed communications. And those same indicators would speak to youth, women, and marginalized communities, and that's kind of how you drive it forward. So that being said, I think the kind of model that we need is to have young people included in the governance and oversight in a sense, right? So you're going to consult young people before you start implementing a solution, but you also have them included whilst you're implementing it, right? And that being said, each of the circles at Transform Health has a co-chair that is from the Youth Council. So you're bringing in both perspectives. And, you know, I was even having a discussion earlier this week with one of my friends, and we were just speaking about, you know, being able to identify what knowledge base young people can bring to a project, and also what expertise persons from different fields can contribute. Because when we talk about like youth inclusion, we're not saying young people need to run the project and, you know, be the ones who are be the final decision makers. That's not it at the end of the day, because everyone's perspective is valid. And even as we talk about young people, like one of my concerns when I look at governance structures, especially in this area of digital transformation, I am always so concerned about the elderly. Like, I feel that it's the two ends of the spectrum, the youth and the elderly. But they're the ones who I see like most vulnerable and, you know, to be left behind. But definitely so far my experience has been pretty good. I think I've been lucky to be, you know, working with organizations like UNICEF, like Transform Health, like the GH Futures 2030, you know, regional youth champions. Like, I've been blessed to be in these spaces that really value and prioritize the youth voice, and it doesn't feel tokenistic. You know, you are a part of the process. And that being said, if there are any organizations here that would be, you know, interested in ensuring their young people feel involved, I would say it's definitely important to do consultations at the start. Like, that's something that the Lancet and Financial Times Commission definitely did. There were a series of consultations, and Wilton Park ran some. And that's, you know, where I was first introduced to the commission overall and the report, et cetera, that was being created. And after you do those consultations, then actually bringing young people into the fold. So they've created a youth council that then helps to disseminate the findings and also gives feedback on, you know, what has been created there. We also did a youth statement separate from the overall report. And again, young people are able to come together and contribute to that. So I think it's all about allowing persons' voices to be heard, especially if you're implementing digital health solutions that are for young people. You can't create it without them, right? And then including them in the implementation. And I also wear a hat as like an M&E person in monitoring and evaluation. So it's important to have indicators around what that meaningful youth inclusion looks like. And also having feedback mechanisms, so you can ensure that as you're implementing this, you're getting that actual day-to-day feedback that tells you if you're on the right track, if persons feel like their voices have been heard, and if the solution being implemented works for them.
Thank you. They're very, very concrete, actually, examples of what is working and that should be replicated, actually. So thank you for that, Daniel. I'm also keen to get the audience thoughts here. So I just had a look at the chat and I don't see any questions, but we do want to make sure that if any of the attendees have any burning questions that they want to ask the attendees, now is the time. So please feel free to put them in the chat, and maybe whilst people are doing so, I can ask a quick question. And actually, David, I want to actually hear from you on a specific topic, because I know you have a strong view on what role the private sector should play in this debate when it comes to digital health, diversity and inclusion, incorporating the different voices. And I know you have some quite good examples of how the private sector is already doing this. So can you maybe touch on that briefly whilst we see if there's some questions in the chat?
Great, thank you so much, Daniel. And I'll start it from before going into the private sector. Actually, I love whatever comment, that sentiment that Daniel has shared as well, because when you look at that approach on having young people, and one key thing that has been a conversation, even from the work that we're doing with agriculture, health and social innovation, is how do we get young people into the rooms? But one key thing that I'm grateful for, and I'm glad that we're having more young people taking the lead, is young people are enthusiastic about change. And with the enthusiasm and the passion that we are coming into the rooms with, we're able to drive that change. And the goodness is we've stopped waiting to be invited into the discussions. We're either creating new platforms or we're actually taking ourselves into those platforms. And that is a good move for us, because if we keep waiting, chances are we might never get to that particular level. Then when you look at it from the private sector dimension and private sector standpoint, I look at the private sector as an enabler. when you look at almost every other digital solution, the innovations, in terms of even starting from the medicines that we're using, most of the medicines are being driven by the private sector developers. And therefore, somebody comes up with a brilliant idea. They feel like this idea needs to see the light of day. And therefore, there's somebody, another person within the private sector to a greater extent, feels like I have the resources and I have the commitment to finance this particular solution. So for me, when I look at the role of the private sector, I look at it as an enabler to bringing the human ingenuity and creativity into light. Somebody comes with the brilliant ideas, an individual citizen comes into a consortium or in a group of people, somebody gives in the financing and drives that conversation. And the other bit in terms of the private sector contribution at the current moment, and especially with the focus on the digital health solution, is the fact that beyond the coming up with ideas, beyond the innovations and coming up with the financing to pump in the money and ensure the innovations see the light of day, most of the time these innovations don't see the light of day because either there is no policy framework and guidance to ensure that they're able to run. I look at it from an African standpoint. I was recently doing just a kind of landscaping analysis and scoping. It's only in South Africa that we have some regulations on digital health. Kenya partly, Nigeria doesn't have any, but they are in the process of discussing to come up with one. Ethiopia has one and Ghana has one. So if even the guidelines and the policies are not there, how do we come up with them? So the role of the private sector to a greater extent as well in terms of the policy is, can we partner with the government regulators so that we have robust regulatory frameworks? And these regulatory frameworks will be establishing what does the private sector want to put into place to ensure that we're able to move into that future together. We should not be seen as enemies. It's a collaborative framework where, as a private sector player and enabler, I'm able to come with the solution, come up with the financing and the resourcing that it needs, but at the same time inform the governments who are the regulators to ensure that we are helping them achieve their mission. And as we are helping do that, can we come up with the guidelines and the frameworks to make it happen? And I think from a private sector standpoint, we don't need to sit back in terms of the policy. That is where the gap is, because at the end of the day, our solutions will never get into the market unless we're able to partner with the countries and the governments to ensure they get there. So that would be a critical contribution in how we shape the conversation and move it forward. Yeah.
Thank you, David. I think that was very clear and very concise, which is great. I see one quick question in the chat from Ofra about patient access. So what happens if patients don't have the tools to access it and maybe don't have the literacy? So all these comments that we've been seeing in the poll or in your interventions, and Einstein, I see you've unmuted and I think you've read my mind because indeed I wanted to go to you with this question. Do you have any examples from in your experience, or have you already thought about this issue?
Yeah, I'll give you a bit of background in the Philippines case. You just don't know. Philippines actually has 7,000 islands, and 2,000 islands of those are only inhabited. So imagine healthcare systems designed in multiple islands. It's a disaster. It's a disaster. But one initiative from an LGU created this access point in a government hospital where you can input a public computer. It's freely accessible to everyone who visits that hospitals, and it's now interconnected elsewhere in the Philippines. However, there's another gap that involves the other health systems within the government. There's still no interoperability. So if you go to this city hospital and you go visit another city of hospital, your data is not there. Your data is not there. So our initiative as a patient organization, we actually has an option to hold our own data. This is where innovations come in. This is where our creativity as a youth leader comes in. Another point that I like to address, where Daniel created a very good point on how youth can really contribute. I like to share a framework called strategic foresight. And this foresight allows us creative people, us youth who has this burning passion to affect change, where you'll be able to predict or understand what is happening here and create multiple futures. It's like the multiverse. You're creating multiple scenarios on what's the worst case, what's the best case, and this will guide them, all of the stakeholders, for a very meaningful strategic planning in the future.
Thank you, Einstein. I think today we've had ChatGPT, now we've had Multiverse. I think you can tell this is a very youth digital-led event, which is great. Maybe just for the sake of time, we have one last poll question that we want to throw, just to hear a bit more, one last thing from the audience as well. Because actually we have Hyper has an upcoming event together with IPSF, and that's going to happen on May 26th on the sidelines of the World Health Assembly. So this is to get you all excited for that. But the topic is going to be about digital health and the role that can play in achieving universal health coverage. And we want to take this opportunity, since all of us are gathered here, and the panelists, please feel free to also share your response in the chat as well, to hear what topics you would like to address in that discussion. So maybe it's something that you've heard today that you would like to delve in a bit more deeper. Maybe it's something that we actually didn't have time to cover, but you would like to hear. So the same as before, same Mentimeter link, same QR code. I think it's a word cloud this time, so it should be quite easy to see. Okay, I see telemedicine. That makes sense. We did address it, but maybe not as much as others would have been interested in hearing. AI also makes a lot of sense. Semantic interoperability. Okay, we're getting technical. Oh, it's getting small. Digitally enabled UHC, very relevant. That is indeed going to be the big framework for that event on May 26th. Data protection, privacy, I imagine, cybersecurity. Yeah, we haven't spoken too much on that, but that is obviously an increasing concern worldwide. Okay, wow, we have a very engaged audience. I'm sure the Hyper team will take that on board, and we'll make sure that is reflected in the agenda for the event. Maybe whilst people are writing the rest of the responses, I want to give the panelists one last chance, 30-second closing statements of what is your key message, what is advice that you have for young people, what is something that you want attendees to take from today. So I know it's a challenge, but in 30 seconds, or maybe just in one sentence, what is something that you want the audience to take away? And Nuriat, I'll start with you. Nuriat, can you hear us? Oh, maybe she can't. Maybe David, you can go first then.
For me, my main call to action, the last statement, is the fact that digital health is here for us. The digital advances are here with us. It's about us finding our path and determining where we are going to plug in. In digital health, we have the data.
Thank you so much, Daniel. Can you hear me? Can you hear me?
Yes,
yes, I can hear you. Yes, I can hear you.
Let her go first, yeah.
Go ahead, Nuriat.
Can you hear me?
Yes.
Okay. So what I wanted to say to the young people is that, yes, we need support. We need the government to put in place systems to support us to innovate in health. We need also, if it's a university, to put in place, for example, innovation hubs where we can be able to innovate and also be supported to innovate, the young people, the students, and any other person who would like to come up with an innovation. Sometimes it's difficult to change the government systems because we are all struggling with commercialization of most of these products, innovation products in health. But let us do what we can as we push for government support and also institutional support in our small capacities. Let us not to sit and wait for the governments to act, but we can push as we also play our part as young people into this space of innovations. That's what I can say.
Thank you, Nuriat. David?
Thank you, Daniel. So for me, actually, as I already started, is one, we have to understand that digital health solutions are here with us and they'll keep being here. The question is, how are we plugging in and how are we shaping that future together? So first of all, as a young person, learn more about what possibilities are there in digital health solutions. What use cases can you bring forth and how do you get involved in those use cases that are coming up? Advances, even we're talking about ChatGPT. ChatGPT relies on data. As a young person, are you able to help us generate that data that will train these algorithms? Because if we don't do that, then it means the people within your vicinity, I'm looking at it from an African perspective, a Kenyan perspective. If the condition that my mom is suffering from in the village are not captured in the training data that is being used to develop these solutions, In the next 100 years, my wife or my children, somebody will suffer from the same disease. But when we are adopting digital technologies, nobody will be there to actually see that this digital technology could find a use case for my solution and give me the right solution. So we need to learn, we need to apply ourselves and see how we can generate that data. And lastly, let's hold each other accountable. And at the core of it is we are doing this to serve humanity. Don't let go of humanity in the science and the digital advances that we're doing. With that, we'll be able to achieve the successes we hope for. Thank you.
Thank you, David. Einstein?
Yeah, for me, it's really finding your deepest desire on helping each other out. In my case, my father is a stage 4 laryngeal cancer, and from there it fueled my passion for advocacy and perhaps innovation on how you can really move forward and not learn and not repeating the same mistake. Speaking of mistake, you learn a lot from your mistakes and take it as a learning tool that will help bridge the gap. And last quote from our organization is that nothing about us without us from all conversations. Make sure to push your voice throughout all of the conversations that you are involved in. And just persistency to fuel that, and you'll be heard.
Thank you, Einstein. Very inspiring. Danielle?
Yes, so for me, there's one quote that I always say, and that's, that young people aren't only the future, we're also the here and the now, which means that we can be a part of the solutions that are being created now. And I'd also just want to quickly reiterate the points around us looking at digital infrastructure, literacy, and ensuring that the projects we're implementing are culturally and regionally specific and relevant. So thank you for having me.
No, thank you, Danielle. And I think that kind of brings the event to a close. Only 3 minutes past the hour, which I think is pretty good. So from my side, the only thing left to say is thank you to everyone. I'll go through the list, obviously. So thank you to the Hyper and the Growing Health Futures team for co-organizing this webinar and the people behind the scenes who have made this possible. Also, thank you as well to the great panelists for today for lending us their time, sharing their expertise, and providing a very engaging discussion. And of course, thank you to the audience for joining, also for engaging so actively with the polls and with the questions and in the chat. We have been looking at that. And yeah, we hope to see you in the next webinar. Follow Hyper and Growing Health Futures on LinkedIn. Follow our speakers there as well so you can stay in touch. And we hope to see you around soon. Thank you.
Thank you, everyone.
Thank you and bye, everyone.
Thank you.
Bye, everyone.
Bye.